Tiffany is the Corporate and Community Health Supervisor at Capital Regions Medical Center in Jefferson City, Missouri. She has been very helpful in working together how to integrate the caregiving model and the employer coaching model, especially starting with their employees. And Tiffany's an RN and has been furthering your education in business management as well. So Tiffany, I'll turn it over to you.
Hi, thank you. Welcome everyone to today's presentation. I just want to start off a little bit about how Capital Region, we're a small town actually, the capital of Missouri in the middle of the state, Jefferson City. We have one hospital, standalone hospital with about 30 clinics. We employ about 150 physicians, and we have 1,500 employees. About 900 of them are on our health plan. We really got together with U.S. Health Center 3 years ago, maybe a little bit longer, when we first started communicating through a local broker that helped us make the introduction. So we currently just service our internal employees. Like I said, we have about 900 on our health plan, 1,500 total, and we do make this program available to all of our employees. We are getting ready to implement our first corporate customer together. Actually, we did their biometrics this week, so their HRA is going to be open here in a couple of weeks. And we have several other clients coming on board in the coming months. How we got going really with these new clients, some are new, some are existing clients, has really been helping them on their journey to wellness. Each organization is on their own path, and we are respectful of that. We definitely have our own path here at Capital Region, and we just have been trying to get them to take one step up from what they're doing. And you know, if they're a client that currently is not doing any biometrics or any type of wellness incentive program at all, you know, we try to step them into biometrics first and then continue to add things over the coming years, which we have done here has worked well for us in kind of creating a culture change, keeping our employees trusting what we're doing and that we're doing things for the right reason. So we have really been coaching our new clients to do the same. When we first got our feet wet in this employee wellness a few years back, we weren't really sure how the coaching would go, so we did utilize a different broker through a U.S. Health Center contact to do our coaching for us, and I realized that we wanted to have that in-house. So U.S. Health Center was pivotal in helping us to get training of our new coaches, help us get our department going, and we are utilizing the coach tracker on the PhD, you know, to do all the documentation for that. So being able to house our wellness navigators, or some of you might call a health coach, our coach, wellness coach, being able to house them here, it has made a big difference for us. We're just starting in our first year of that here. All of our employees met with a coach for the first time this fall, and we were concerned about whether or not being our own employees would help or hinder those relationships, and it actually has been very good for us, and we do appreciate U.S. Health Center helping us. They linked us up with the Health Coaches of America, of which we did the training, and they were really great. Actually, they came on site and were as responsive to us as we could imagine anyone would ever be. So, like I said before, we're a hospital, standalone. We actually were two hospitals that merged in the 1990s into one. We do have one competing hospital here in town that is a part of a large system, but they don't really dabble in the employer wellness realm. So we do have that going for us here. That market is really open for us. Our participation rates that you can see there in the fourth bullet, they have increased 77% in 2015. I will make a note, though, that those participation rates are based off of our total population because we allow anyone to participate. So the participation rate of those on the plan is actually a higher number than what is representative there. But our incentive is based on health insurance rate premium discounts. So those that aren't on our plan, there really isn't an incentive besides, free lab work and a free HRA to get them enrolled in the program. And we are, discussing what to do differently about that for 2017. So our risk trend, Gavin was explaining to you a little bit about how that number is calculated, and we have a repeat participants over the last 3 years. That number is 563 folks. And for those folks who have done the HRA the last 3 years, we have seen a 38% improvement over our total exposure per participant, which is, exciting news for us for sure. We're looking now at those risks, and what we're seeing, and when we look at our health plan data, is that our health plan cost for our employees has gone down, significantly each of the 3 years that we've been engaging in this more robust employee wellness program. But our spouse costs are what's continuing to go up. So now, when we look forward to what we can do to improve that, is, how do we engage the spouses into our employee wellness program? So how our program structure works, we have a lower cost share for employees who are tobacco-free. We do that through a blood test for cotinine. That cotinine score is actually a very large percentage of the WellCentive score that is calculated when we upload that data into the Personal Health Desktop. We actually collect all of our blood here locally and our hospital, process it, and then we send a secure data file which is uploaded into the HRA, and they, Rachel and the group there at U.S. Health Centers are very responsive in making that happen as smoothly as possible for us, allowing us to still, keep some of that work in-house for our employees. So we use the WellCentive score that Gavin mentioned earlier, and I think Justin also spoke of. The biometric, the WellCentive score is purely driven by the biometric data, so we do use that score for our employees. Even last year, we're giving some discounts for those who were showing improvement. So if you had a score of less than 75% for a plan year, then you needed to go to see a health coach in order to obtain your discount. So that was the reasonable standard to obtain the incentive. But this year we did offer in that if you had made a 5% improvement over the previous year, that you could get that discount. So trying to change it up, create a positive feel in our culture for those who are trying to make change, and I think that went over very well this year. The services that we use currently are the Personal Health Dashboard, the HRA, the Coach Tracker, the Health Counts and Paper Portal, the laboratory data integration, and then the Health Coach certification. So I think one of our favorite tools is the HRA, and if you are someone who is working to market these services to local employers, you're probably finding that it's easier to market those services to those companies who are self-insured. We certainly are ourselves, and there are others who have access to use an HRA through their plan or their carrier for free. And what we then, with the help of U.S. Health Center, can show them how different this tool is. So I love the HRA tool and the data that we receive out of that. Being able to really focus on these pre-disease risks before the folks are diagnosed is critical for us as well as for other companies who are self-insured. This data helps us identify those folks who are on the bubble, that if they don't make significant changes in the next 3 to 5 years, will be people who are diagnosed with disease, and that's when we start feeling that financial strain on our health plan, is those new diagnoses. So that definitely is something that helps us market this product to our local employers, and they're seeing that. They're seeing that there's a difference. Many of them that are using their outside HRAs, the folks that are on their plan go and complete their HRA prior to even doing their biometrics. So they never see the tool totally, in a useful way, that they're seeing their biometrics along with that data. That data, we use it for a health contingency program, utilizing those pre-disease as well as the current diagnosis. We use that data to see who has to go to coaching here. So if you have a pre-disease risk or current diagnosis, we do require that you enroll in a coaching compliant visits, which is 4 visits within basically a 6-month period. I will point out that we actually have every one of our folks who participate in the plan have to see a health coach at least one time to review their risk, their health risk assessment, and their biometrics. And that has helped us tremendously, too, in making sure that folks are understanding what their risks are. They're taking a chance to kind of slow down and evaluate what their lab values are, etc. So the aggregate data, which actually we are on board to meet with U.S. Health Center next week to get our latest summary, but last year we really were noticing that our rates for sedentariness were increasing over the previous year. So we put in a Fitbit program here. My goal was really to get 150 people on board the first 12 months, and within the first 3 weeks of announcing the program and getting people signed up, we had over 500 people here enrolled in our program, and our CEO says this Fitbit program was the best thing we ever happened to our little hospital. So it's a great program. We run challenges, and we reimburse people once they hit 2 million steps for the cost of their Fitbit, but they buy it up front. Another way we used the data was for back problems. Is one of the current disease processes that we were noticing on our HRA data. We are a hospital, so we have residents and interns who float in and out of our system, and we utilize them for a reduced price of $5. Any employee can go over and have OMT. So as a part of our DO's training for the residency here, they have to do, see so many patients, so it's helping them as well as it's helping our employees, and that program is very well utilized. We also looked at the data for finding some things like depression, anxiety, gastric reflux. We were able to bring programs regarding the brain-gut connection. I will say that this isn't the only data that we look at. We also look at our claims data and our pharmacy utilization to help us, kind of figure out what services and programs we should put in place. For instance, we spent $85,000 the year before last on Nexium. So apparently there's some education that needed to be made regarding, gastric reflux, what sort of foods, and depression, anxiety, and how all that was connected. Obesity, our levels did continue to increase, which seems to be a trend nationally. So we put in the Fitbit program, like I mentioned earlier, Weight Watchers, and then we do weight loss challenges between departments and individuals here that keeps things interesting and fun. So pre-disease conditions and the personal coaching I discussed earlier really has helped our coaches to work specifically on some issues, but we have folks that are working on things as simple as adding water to their diet, and some adding fresh fruits and vegetables. We have, like in any other organization, folks who never eat any fruits and vegetables, and the coaching is really helping them to work on some very specific goal setting, and the coach tracker on the PhD has been instrumental in helping them document those services. So what is next in our relationship with U.S. Health Center? Like I mentioned earlier, our first joint client, we just did our biometrics for this week, and they'll be opening their HRA, and then we have a couple of new clients slated to go about every month for the next several months. We're very excited about that growth and the possibility. We also are going live this month. I just opened that up this week for private pay consumers to use our same wellness navigation. So basically the things that we're offering at an employer level, now we're opening that up on an individual level as a way really to address the population health. So it should be mentioned that community benefit and population health are also ran out of my department. And whenever we start looking at how we can impact large groups of people at a time for population health and community benefit, it only makes sense to make those relationships with employers where we have a large group of people in one place at one time. But we also want to see what we can do on an individual basis. So we're working with our physician groups on how they can refer their patients over to our wellness navigators to work on lifestyle coaching, nutrition, fitness, and stress and sleep, disease management. And so far, our physician groups have been very receptive and in referring their patients over to us. We're also investigating ACO opportunities. U.S. Health Centers is helping us run that, and looking at expanding our broker relationships in the region and utilizing them to also market our services when they're working with their plan members, just to kind of make sure that they're aware. And actually, all the local brokers that we have here in town, we have 3 main employer plan brokers, and they all utilize our service for their own individual companies, so they're able to share our successes with their clients and help us tell our story a little more.